ExCPT Exam Review Pharmacy Technicians Practice Test and Study Guide, 25 Difficult Questions. Question 1. Which federal law created the schedule system for controlled substances? Food and Drug Act of 1906. Controlled Substances Act of 1970. DSCUSA. OBRA 90. The CSA of 1970 categorized drugs into 5 schedules based on abuse potential. Question 2. How often must a pharmacy perform a complete inventory of controlled substances? Every month, every 6 months, every 2 years, every year. The DEA requires a biennial, every 2 years, inventory of all controlled substances. Question 3. What is the maximum number of refills allowed on a Schedule III prescription? No refills. 5 refills in 6 months. 11 refills in a year. As many as the doctor wants. Schedules 3 and 4 can be refilled up to 5 times within 6 months of the date issued. Question 4. Which do not use abbreviation is on the ISMP list? QD, BID, TID, PRN. QD, once daily, can be mistaken for QID, 4 times daily. Question 5. What is the generic name for Lipitor? Simvastatin, atorvastatin, pravastatin, rosuvastatin. Atorvastatin is the generic name for Lipitor. Question 6. Which class of drugs is used to treat high blood pressure by blocking calcium channels? ACE inhibitors, beta blockers, CCBs, statins. Calcium channel blockers, CCBs, like amlodipine treat hypertension. Question 7. A pharmacy technician is asked to compound a 1% cream using a 10% cream and a base. This is an example of trituration, alligation, levigation, geometric dilution. The alligation method is used to calculate proportions for mixing different concentrations. Question 8. Where should insulin be stored in the pharmacy? In the freezer, on the room temperature shelf, in the refrigerator, in a locked safe. Most insulin products must be refrigerated until opened. Question 9. What does PRN mean in a pharmacy setting? By mouth, before meals, as needed, immediately. PRN stands for pro re nata, or as needed. Question 10. Which organization is responsible for issuing drug recalls? DEA, FDA, USP, NABP. The Food and Drug Administration, FDA, oversees the safety and recalls of medications. Question 11. A Class 1 recall means the drug is safe. There is a high probability of serious health consequences or death. The drug might cause temporary health issues. The drug has a minor labeling error. Class 1 is the most serious type of recall. Question 12. What is the primary purpose of a prior authorization? To make the drug cheaper, to ensure the insurance company will cover a specific medication, to allow the technician to fill the script, to let the doctor know the drug is ready. Insurers use PA to control costs and ensure medical necessity. Question 13. The Orange Book is used to look up drug prices, check therapeutic equivalents of generic drugs, find side effects, read about herbal supplements. The FDA's Orange Book lists approved drug products with therapeutic equivalence evaluations. Question 14. How many milliliters are in 1 teaspoon? 2 ml, 5 ml, 15 ml, 30 ml. 1 teaspoon, TSP, is equal to 5 ml, 1 tablespoon, tablespoon, is 15 ml. Question 15. Which law requires pharmacists to offer counseling to Medicaid patients? Pure Food and Drug Act, OBRA 90. HIPAA, Patriot Act. The Omnibus Budget Reconciliation Act of 1990, OBRA 90, mandated patient counseling. Question 16. A patient is allergic to penicillin. Which antibiotic class should they use with caution? Quinolones, cephalosporins, macrolides, tetracyclines. There is a cross-sensitivity risk, approximate 10%, between penicillins and cephalosporins. Question 17. What does HIPAA protect? Drug prices, patient privacy and health information, pharmacy profit, technician salaries. The Health Insurance Portability and Accountability Act protects FI. Question 18. A prescription reads 1 tab per QID. How many tablets are needed for a 30-day supply? 30, 60, 90, 120. QID means 4 times a day. 4 tabs * 30 days equals 120 tablets. Question 19. Which part of the NDC number identifies the manufacturer? First 5 digits, middle 4 digits, last 2 digits, the whole number. The first segment, labeler code, identifies the manufacturer/distributor. Question 20. What is the proper way to clean a laminar flow hood? Left to right, back to front to back, circular motion. Cleaning should go from the cleanest area, /HEPA filter, toward the front.